I'm Mark Doran. I'm a SCCS trainee, which is essentially I'm an acute trainee specialising in emergency medicine.
So tell me what the junior doctor strike means to you. Why strike?
I suppose for me personally, my biggest fear is genuinely about the direction the NHS is going. And I genuinely feel like this is a sort of big step towards privatisation of the NHS. Already I'm an emergency medicine trainee, so I'm actually not striking today. I've just finished night shifts, but already you can see a few of the things that they've done in recent months, like reducing local mean wages for both doctors and nurses, having a profound effect on A&E. We were short-staffed with nurses last night. The nurses aren't going to cover it for less money, and a few other nights we've had short-staffed with doctors as well. So there's things like that are chipping away at it. Getting rid of the student bursaries for nurses, that's going to have such a profound effect. There already aren't enough nurses. And I think if these junior doctor contracts go through, there will be a mass emigration of doctors. People will either go to Scotland or go to Northern Ireland, or they're going to go overseas. You can Australia, Canada, Singapore. I have a friend who's in Singapore who I went to medical school. He's just got a massive half a year's pay bonus in work. He's obviously appreciated the hard work that he's doing, and we're not asking for that, but it's just these things are just so tempting for junior doctors.
So patients see the news, they see this implementation of this new contract, they see the 11%, and as far as patients are concerned, maybe they just see it about money. Is that the case?
No, I don't think it is. For me, this is just me for my sort of personal thing. I think that I think we have a right to strike. If it was just about money, I think that this isn't about a pay raise. We don't want a pay raise. This is about not getting thousands of pounds a year taken off our contracts. And to me, that's a reason enough, but that's not the reason that I'm striking, and that's not the reason I can sort of hand on heart say that most of the people here, or if not all of them, are striking. I think genuinely people are worried about the knock-on effect that that's going to have on staffing, the knock-on effect that the removal of safeguarding for hours is going to do. Bearing in mind also that one of the biggest safeguards that we have for ours is a 48-hour working time directive, which is an EU law. If Britain leaves the EU, we're not going to have that. So we're going to have, it'll be back to the sort of old days, if you will, like they have in America or in the Republic of Ireland. They have shocking, almost sort of third world healthcare systems because of lack of junior doctors. Really tired doctors, they just go to Australia. That's that's the done thing, Republic of Ireland, because the conditions are just so bad, they leave.
Hi there, my name's Jenny. I'm one of the colorectal FY2, so I'm a foundation doctor at Royal Blackburn Hospital.
Can you tell me, and therefore patients, members of the public, why is you striking today?
So we're striking today about our junior doctor contract that is threatened to be imposed upon us in August. Lots of different issues going on with the contract, but mostly we're striking here for patient safety and for protection of our antisocial hours pay.
So am I right in thinking, and obviously I've done a little bit of research, that currently hospitals and trusts can be fined or have financial penalties imposed upon them if they ask junior doctors, nurses to work past a certain level. This contract will take away that safeguard.
Yes, precisely. So we're monitored for a few weeks every rotation. So every kind of 4 to 6 months, we input what hours we do. If they're fitting to be over what we're supposed to be doing, the trust gets financial penalties that sometimes, very rarely, comes back to doctors in the form of overtime, but not very often. And yes, this new contract removes those financial penalties, so that hospitals have no real disincentive to work as long as there's no consequences to it apart from more doctors on the shop floor, even if they are very tired and overworked.
I've been asking your colleagues, perhaps you'd comment too, that many patients see this just as purely as a money thing. That's not right though, is it?
No, not at all. I think you'd, although it's contrary to what the public think, I think you'd be in the wrong business being a doctor if you wanted to make money, unfortunately. This is about so much, at the moment, after a long shifts, you can go home and worry about something you've done, have to call up a colleague. I don't want to have to do that more often. It's scary as it is our job. It's a lot of responsibility. We have a lot of training for it, but you are dealing day in, day out with patients' lives. It's not about money. Obviously, it's to have a pay cut when you work so hard, it is insulting. You want to be happy at work because we're here all the time. And so, although it is about money, and I'm not ashamed to say that, but it's not just about money.
Looking at the bigger picture, how fearful are you for the NHS in its current format?
I'm terrified, really. My actual application to medical school wasn't about wanting to be a doctor. It was about wanting to work for the NHS. It's, in my opinion, the best thing about Britain. Everybody else in the world should be jealous of it and are jealous of it. The fact that you don't have to worry about when you're having a heart attack that your home's going to be repossessed like you do in America. It's incredible, and it's for the public by the public, and it's incredible. I fear that one day you'll have a bill at the end of your hospital stay, which is just ridiculous. It's a horrible time in your life to have to come into hospital, and you shouldn't have to worry about money while you're here.
We're stood here at the grounds of the hospital, and obviously we can hear members of the public hooting their support for you. How does that make you feel?
It's great. It kind of wells me up, and I'm not an easy person to do that for. Last time and this time, members of the public, we've got a chap just over there talking to some of the doctors who come over. They give us Quality Street. They're giving us treats. They're honking to our honk if you love the NHS sign. It's really great. I think public opinion is really with us because they know the history of this government with health and social care.
My name's Rebecca, and I'm a Foundation Year 1 junior doctor, and I work over in the psychiatry unit just in Blackburn Hospital. So junior doctors have been negotiating with the government for about 3 years for a new contract which affects all doctors that aren't consultants working in the NHS. So these negotiations haven't gone very well. That's an understatement. But it's got to the point now where the government are just trying to impose a very unfair contract that we feel is going to have a really big impact on our patient safety in hospitals up and down the country, which is why we're all really upset and quite angry, and why we've come out here to show that we're quite upset and angry by striking today. This is my personal opinion, but I really feel like this government does not have the National Health Service as one of their priorities. I think they see it as a massive drain on their resources. Jeremy Hunt, who's the current Health Secretary, wrote a book about how he wanted to privatise the NHS. So I really don't think that the government care very much about this public service and don't have it as a priority. And I feel like this contract negotiation is part of that. The BMA a couple of days ago put forward a contract which was cost neutral for the government, and they just went out and rejected it outright. And I find it difficult to see why we could have prevented these strikes. A lot of poor patients have had their operations and appointments cancelled, and I sympathise with them because I feel like this doesn't have to happen. If the government just kind of appreciate what we're trying to say, and that's not the BMA, it's all junior doctors are saying it. 98% of junior doctors are saying that this contract is really not safe for patients and not safe for us to work it. Can you just explain why it's unsafe? A lot of patients don't understand why that is. Definitely. So basically why we feel it's safe at the moment, hospital trusts, every hospital has a fine if they work us over the recommended hours. Even with that, rotas aren't stocked properly up and down the country, and hospitals have to pay this fine. So what this contract will do, it will remove this fine that hospitals have to pay. So it's not going to, we all know that hospitals, managers kind of, money is an incentive, isn't it, for any trust, any business. So if you remove these fines, what's going to incentivise the trust? And we're worried that we're going to end up working really unsafe, long hours, which will have a knock-on effect on how our patients are treated, because when you're tired, if anyone doing a job is tired, they will end up making mistakes, and when we make mistakes, it's catastrophic because we end up sacrificing people's lives, and that's not what we want, and that's why we're so worried about this.
How important is it to you to have, and we're hearing it in the background, how important is it to have patient to public support?
Do you know what, it's been the most humbling thing being here today and on the other strike day, because we've had patients come up and say how much they believe in our cause, and I'm really affected by it because they don't necessarily have to. People have been quite put out by the way we've been striking, and I appreciate that, and it's just really, really lovely to see that they do understand why we're doing it. And it's not just about pay and all that stuff. There's a lot of really serious points in this contract which will affect every person who uses the NHS, little children to elderly people, the mental health services, everyone. So it really does, this contract affects everybody out there who uses the National Health Service, and that's why I'm really happy that people understand that. People are understanding that, and they're showing their support, because we wouldn't be able to do it without patient support, and we wouldn't want to do it without patient support, because at the end of the day we're public servants. We're here, we work for the NHS because a lot of us could have gone and done fantastic other degrees which have given us, hint hint bankers, which have given us thousands of pounds of bonuses, but I didn't want to do that. I want to work for the public. I want to do something that makes me feel happy at night, and I want to do my patients justice, and I want to work for a national health service. I don't want to work for any other health service, and that's why I feel so passionate about why we're striking here today.